induction. Basically, if you are coming for any induction class or any introduction part or any demo class, definitely you will come with your some questions, right? In the similar way here, I think most of your questions will be cleared within the agenda itself, as well as from next portions. So just look into it. Here you will be learning about what is the medical coding background and its career opportunities, as well as you will be learning about what are the coding specialties that are available for you. And you can know about the medical terms, the codes, and its versioning and conventions. Apart from that, sorry, I think it was closed.
అమ్మాయికి చెల్లు చెల్లు అడుగు తాత చెల్లు ఇవ్వను లాభం
Yeah, Dave. Apart from that, you can see the medical terms and its versioning and conventions. See, similar to app, in app also you will be having versions, right? In the similar way, here also you will be having the versions, ma. You will be having the versions. In the same way, you can see the certification related. What is meant by the certification? And from where you need to do the certification portion. Means what is meant by the AAPC or CPC. So those things you will be getting to learn, as well as the software tools that are used in the medical coding. Apart from that, you can see the job description or the roles and responsibilities of a coder with some of the live examples. So just look into here. This is myself. Say, as you all know, myself, I am Praveena. I'm the CPC registered corporate trainer. I'm not only teaching here, ma. I was a corporate trainer in other organizations also, in the companies as well. Okay. Basically, I am from NIMS. I am from NIMS. I have graduated from NIMS. Like I am from a nursing background. Currently, I am completely a RCM specialist. RCM specialist in the sense, I'm having 10 years of experience in the medical coding field, and I have completely experienced in all the specialties that are available in the medical coding. Initially, after graduation, I have did for 1 year into the clinical platform, like ICU or chemotherapy or these words, and then I have moved into this medical coding. As during the time only, it was like such a booming nature, and now it was like, we can say like explosion. It was like explosion. Moving on to what you will learn. See, you can able to understand what is the structure of a medical code. See, if you are going to pin code, what is the structure of a pin code, team? Team, what is the structure of a pin code? Team, what is the structure of a pin code? See, in a pin code, you will be having the 6 characters, right? And the initial 3 characters will represent always the area code. In the similar way, here also you will be having, for diagnosis code, you will be having 3 to 7 characters. First 3 characters will always represent the disease or injury or everything. And you can see, in case of surgical CPT or material CPT, you will be having the 5 characters in your code. So the first 2 characters will always explain you about for which surgery they have underwent. So this is about your basic understanding of a medical code. Then moving on to, you will be getting to learn what are the coding syllabus that are important for us in order to learn, or what are the specialties that are existed in the coding. Sure. What are the specialties that are existed in the coding? Yeah. Apart from that, you also will gain the knowledge on how to pick a code from coding books. See, in order to do this as a medical coder, you should at least know how to pick a code, right? How to pick a code. So here you will learn from the book, as well as you also will learn from the software. You also will learn from the software also. Moving on to, you will also gain the knowledge on the types of health records. See, in the types of health records, I can directly state it as like, one is a handwritten documentation, one is a electronic medical record. Electronic medical record in the sense, it was like direct transcripted document now. So you will be gaining the knowledge of So you will gain the knowledge about the types of health records now. One will be like electronic medical record. The other will be like you will also learn the knowledge about the handwritten documentation. These are the two types of medical records. And not only that, you can also listen to the software tools that are available in the medical coding. Okay, the software tools that are available in the medical coding. See, generally, if you want to work on the coding books, means if you want to search or navigate from the books, it is not easy to navigate. If you are doing in the software, then only you can complete your 50 target on a day. So that's why you need to understand about the software tools as well as how to enroll for a certification. This all you will learn in this induction. Moving on to what is medical coding. See, generally before going into induction or demo class or webinar, you will be just researching on it, right? So what is meant by the medical coding now? What you have researched on that and what you have gained? Tim, what is meant by medical coding? Okay, Tim. Medical coding in the sense it is nothing but we are transforming the alphabetical data into the numerical form. Here, what is the alphabetical data? It is nothing but the diseases, the surgery, as well as the material and supply. Everything, whatever in the alphabetical name is there, that we will be converting into the text form. So that we will be calling it as nothing but the text form into the numerical form. That we will be calling it as the medical coding. So currently we are receiving only the outsourcing project from USA. But apart from USA, you will be having the all other states also will be following the same type of medical coding process. I will be explaining in the further sites for that. Moving on to the benefits. If you are using any app, there should be some benefit, right? Here also there will be the benefit of using the medical coding. One is like for the statistical analysis, the other is for diagnosis related grouping. And you can see like you can easily track the morbidity and mortality rate, nothing but the illness and death rate. As well as you will be finding the evenness in the type of treatment now. Like if they are joining in Apollo or KIMS also for same similar fever and staying for 2 hours or 24 hours duration, but they will be charging like similar amount. There is no unevenness in the amount. That is diagnosis related grouping. And you can see like easy tracking of pandemic events, nothing but the COVID related or any endemic related, this all comes under easy tracking, and easy storage or access of data at any time when required. See, for example, if you are going to Apollo and if you are moving to other hospital, no need to carry your health record with you. You can directly go there and tell so that your record will be automatically updated in their system or tracked in their system. And because of this medical coding, you can also decrease the fraud. You can also decrease the fraud. So this is about the benefits of medical coding. Moving on to the history of medical coding, when it was been invented and why it was been invented. See, during the England in 17th century, in England in 17th century, London bills of mortality, people are used to track only the death rate during the time. They have implemented this medical coding. In 1830, and British epidemiologist William Fork, what they have did, not only for the mortality, we can also assess the morbidity rate also with the help of medical coding. Fine. So because of this, it was reduced the manpower, So during the 1977, the US people has adopted this coding process from England and they have converted into international classification of diseases. So since from 19th century, you are using it as international classification of diseases, 9th revision, clinical modification. Then there was a updated version since from 2015, we are using it as ICD-10-CM, international classification of diseases, 10th revision, clinical modification. So in 2023, might be there was a new update like ICD-11-CM. Clear, team? Clear with the history as well as versions? Okay. Moving on to the revenue cycle management. See, revenue in the sense it is nothing but the income generation. How the income is generating to the provider. See, generally in India, what is the case? See, if we are going to provider, definitely we need to pay some amount of money and then only we will reach to the provider, right? But in US, it was not the happening. Why? Because all the employees or all the individuals who are not employed also, they will be under insurance only. So because of insurance, they will be directly reaching to the physician and they will be getting eligibility check and doctor will treat it and they have scanned the document and entire the coding process will be completed and it was submitted to the claim also. And finally, the reimbursement will be released to the doctor. Means here there is no direct payment by the provider from patient. Here the payment will be received from the insurance company. In order to get this reimbursement properly, here there should be the three pillars. Who are those three pillars? There should be a medical transcriptionist, there should be a medical coder, there should be a medical biller. Without these three, there is no income generation in a timely manner for the provider. So this is about your revenue cycle management. Moving on to your future and career growth, ma. See, once you have joined into any course, definitely you will look into your future, right? At least 10 years, it will be like stable. Yes, it will be like stable only. See, apart from software organization, see, if you are having the software, if you are joined into software organization, today there will be like Java appraise. Tomorrow they will state like Angular Java is fine. And day after tomorrow, they will state like you need to learn SQL. After day after tomorrow, they will state it as not SQL, mama. You need to learn it as like some other course like BW. Means there were some updates in the software, but here in the coding, it was the same subject only. There is nothing implemented. Just only the minor changes will be there. That's all. But there will be some certain guidelines when you are reporting. So here you can look at, see, the future will be like, it will be like booming in nature. No need to worry at all. If your performance is good, if you are doing your duty on timely manner, if you are maintaining your attendance, everything, once you joined as a coder level, you can move into senior coder, group coordinator, team leader, trainer, assistant manager, manager, director. These are the positions which are available over there. But in order to achieve this, you need to have sound knowledge on human anatomy, terminology, as well as abbreviations. After completing this completion of course, if you are writing a certification like AAPC approved certification, then your salary, your positions, everything will be depend upon that only. And please remember, you are also having an opportunity like you can work in the abroad also. You can work in the abroad, like Abu Dhabi and Singapore. Both the countries is accepting the AAPC certificate. And not only that, if you are having some connections in US, you can also start a small business and try to get a small client. You can have your own business now. So this is about your future and career growth. And moving on to the eligibility. See, in the eligibility, I can say directly a physiotherapist, nursing, pharmacy, B Pharmacy, M Pharmacy, D Pharmacy, biochemistry, biotechnology, any number of life science graduate. Not only a graduate, any diploma graduates also will be eligible for the medical coding course. But mainly, basically, it stresses on life science. Moving on to the specialties in medical coding. See, in a hospital, how many departments are there? Similar to that, here also you will be having that many departments. See, in a hospital, you are having the ICU department, surgery department, oncology department. You are having the other departments like cancer department, radiology department, laboratory department, right? You are having similar to it. For each and every department, there will be some different guidelines in terms of coding. So here, once you are certified, if you are placed into any organization, you will be having different platforms of certifications, like you will be having laboratory, pathology, radiology, hierarchical condition category, emergency casualty coding, surgery coding, inpatient coding, wound care coding, cancer coding, anesthesia coding, denials, ambulance. So I have listed only 8 here, but there are few more that are present in the medical coding platform. Moving on to the medical coding process in India. See, generally everyone will look into, yes, we are outsourcing the project from USA. If USA will ban, what about the companies? See, currently there is no banning in nature. Why? Because they will get the cheapest platform is from India only. So that's why we are receiving the work from only US. And one more thing, see, in India also, you can find some of the hospitals like Jipmer, PIMS, AIMS. These have been started the implementation like similar to medical coding process, okay, which is very similar to USA project, but it was still in implementation course, ma. It was started from 2020 only during the pandemic. So if it is getting successful, then definitely all the Indian hospitals also will be adopted to this same platform. And you can see the companies like medical coding companies, you can find like almost in all the organizations, like in all the metropolitan cities, you can find all the organizations which are having the similar IT industry like Chennai, Hyderabad, Trichy, Salem. Everywhere there is an organization for you. Not only single organization, you are having 10 to 15 organizations on the same medical coding process. And apart from that, you can see all companies are similar to IT industry pattern. The work culture will be like general shift, 9 to 6, and then you will be having the increments, the salary, everything will be purely based upon your talent as well as your skill and knowledge, as well as your quality and production matters here. Moving on to the course outline, nothing but the syllabus. You will be covered with all 4 modules, ma. If it is like CPC certification course, if you are enrolling for only basic certification course, you will be covered with only 3 modules. The cost will be like, if it is basic certification, the cost will be 10K. It is for 1 month duration. If it is like CPC certification, the cost will be like 25K. It is like 2.5 months certification course. Moving on to the module 1, it is like medical terminology and laboratory values. Module 2, anatomy and physiology. Module 3, it deals with ICD-10-CM, nothing but the disease coding. Module 4, the surgery coding, nothing but CPT and HCPCS. So this is a general brief idea about module 1 and 2. You can see here medical terminology, nothing but the language of medicine. See here, the language of medicine means it is nothing but whatever the terms that are derived from Greek and Latin. As we are not aware of the Greek and Latin, definitely you need to understand the meaning of it. So just look into here. The medical terminology, it consists of the 4 parts. Those are like root word, combining form, suffix and prefix. See, root word is nothing but this is the foundation of a medical term. Nothing but the name of an organ. Then combining form is nothing but whatever the combining vowels that are attached to the combining form or root word, that we will be calling it as a combining form. Moving on to suffix, whatever the term that is attached at the end of the medical term, that is known as the first suffix. Whatever the term that is attached at the starting of the medical term, that we will be calling it as prefix. Moving on to the anatomy and physiology. See, as we say, the human body is a living mission, ma. Living mission. Why? Because each and every organ need to function properly. If any organ fails, definitely your entire body functioning will be lost. So you can see here, there are discussed like 10 systems for you. Musculoskeletal system. See, we are running, we are jumping, we are sitting erect. Everything is possible because of musculoskeletal system. Cardiovascular system in the sense, see, our body is completely receiving the blood circulation. How it is possible? It is from heart, right? It is from heart because of cardiovascular system. Then respiratory system. Respiratory system in the sense, see, our body is receiving the oxygen and carbon dioxide is expelled outside. How this is possible? Because of respiratory system. See, our body is completely externally covered via integumentary, nothing but the skin.
Recording in progress.
Nothing but the skin that comes under the integumentary. And nervous system. See, we are receiving the impulses, right? That is mainly due to the nervous system. Then digestive system, it is nothing but, see, we are eating food 3 times a day. How it is digested for us? This entire process you will learn in digestive system. We are drinking water every day. Then how the urine excretion is possible? That you will learn in urinary system. Endocrine system in the sense, every female will have once in a month, they will be having the menstrual cycle. How this is possible? Because of endocrine system. The lymphatic system. See, during the pandemic, only few people are affected with COVID. Some are not affected with any COVID. Due to why? Because they are having the immunity system in their body. That is nothing but the lymphatic system. Then reproductive system. Reproductive system in the sense, it is nothing but the regeneration or the new growth or how the baby is formed. What is meant by the sperm? What is meant by the ovum? So these all you will be learning in the reproductive system. Moving on to module 3, ma. Module 3 is related to the ICD-10-CM. It is nothing but the disease coding. What is meant by ICD-10? It is nothing but International Classification of Diseases, 10th revision, clinical modification. This is used to code only for the diseases. This is used to code only for the diseases, signs and symptoms. See, diseases in the sense it can be like a migraine, seizure disorder, seizures, okay, paralysis. These all you will be calling it as the diseases. Then signs in the sense it is nothing but whatever the physician is assessing. Like fever is there, how he will assess? He will be assessing on the basis of the thermometer, right? That is a sign. Then symptom in the sense, see if you are having any condition, they will be telling you, right? I'm having the headache. That is nothing but the symptom. Clear, team? So for diseases, signs, symptoms, you will be able to code from ICD-10-CM. What is the code structure? Here you will be having the code structure from 3 to 7 digits, and the chapters in the sense you will be having the 22 chapters, and you can find the laterality specifications like left side, right side, and bilateral. And not only that, you will be having 2 excludes notes and dummy placeholders. See, this is the just a basic feature of ICD-10-CM. So just see here, it is International Classification of Diseases, 10th Revision Clinical Modification. It was published by WHO, World Health Organization, and every year on October 1st, you will be having the new updates. And the structure of your code, it will be having the minimum 3 characters, and maximum you will be having the 7 characters in a structure. Then after every 3 characters, you will be having a decimal point. It is nothing but the category mark. And all the codes are alphanumerical. Means the code that starts with alphabet and ends with a numerical character. Clear, team? Then ICD-10-CM consists of the 2 volumes. First volume we will be calling it as volume 2, and second volume we will be calling it as volume 1. See, volume 2, it consists of, means the first half of the book, it consists of 2 alphabetical indexes. The 2 alphabetical indexes are nothing but, those are similar to dictionary only. How you will search in the dictionary? In the similar way, you need to search here. Like all the disease conditions are organized on the basis of the alphabetical order only. So you can find these 2 alphabetical indexes. One is the index for diseases and injuries. The other is for index for external causes. External causes in the sense, it is nothing but how the incident is happened, whether it is fall from stool or any walking on the road. So how the incident is happened for them. So that you will be having in the external causes. And apart from that, you can find the 2 tables. One is table of drugs and chemicals, and the other is table of neoplasm. So these all you will be finding in the first half of the book. And you can see the last half of the book, there was a tabular list of organization. In the tabular list of organization, you will be having like 22 chapters. So you can see here all 22 chapters that are grouped on the basis of its anatomical location. And you can see in the volume 1 and volume 2, how these are organized means. See, though I have stated the volume 1, it is similar to the dictionary, but these are organized like a main term, subterm, and sub-subterms. Like, see, I am stated in the impression as acute gastritis with bleeding. So here gastritis will be your main term, then acute will be your subterm, then with bleeding will be your carryover line. So how you will pick a code now? You should not pick a code from gastritis. You need to pick the code from carryover line, which is with bleeding. There you need to pick the code. Moving on to the tabular list. See, this is the tabular list. How it is organized means it consists of the 22 chapters. All the chapters are grouped like section, category, and subcategory. And you can see the structure of your code. Like it can have 3, 4, 5, 6, and maximum like 7 digits. You can see the CPT and HCPCS features also. Like CPT, we will be calling it as current procedural terminology. See, this is used for surgery for the outpatient setting. If any surgery that is happened in the inpatient, what is the book you need to search? That is ICD-10 PCS, that is procedural coding system. See, this book is published by AMA, American Medical Association. Every year on Jan 1st, you can see there is a revision in the book, and all codes are completely with a numerical codes only. Nothing but all starts with a numerical and ends with a numerical code. Then this book consists of the 3 categories, category 1, category 2, and category 3. See, category 1, that are grouped like introduction to CPT, place of services, modifiers, evaluation and management, anesthesia, surgery 6 chapters based upon the anatomical location like integumentary, musculoskeletal, as well as you can see the respiratory, cardiovascular, heme and lymphatic, digestive, urinary, male and female reproductive, and maternal and intersex surgeries. And not only that, you will be having endocrine, nervous system, eye, ENT, and auditory. Those all comes under the surgery. Then you can find the radiology, pathology, medicine. These all are present in category 1. Apart from that, you will be having the category 2 and category 3. This is the organization of the CPT book. Then HCPCS. HCPCS is nothing but Healthcare Common Procedural Coding System. This book is used for the material and supply. See, if we are doing any surgery, for the surgery, we will be receiving some material, right? For example, patient is having fracture. So for some period of time, he may not be able to walk with his own leg. So what the doctor suggested? The doctor suggested like you need to use a walker. So walker, you need to code from HCPCS. And this book is also published by AMA, American Medical Association. Every year on Jan 1st, you can see this book will be updated. And all the codes are alphanumerical. Means the code will start with the alphabet and ends with a numerical. Moving on to how to start your career as a certified medical coder and which certification is required to start as a medical coder in USA as well as other countries. See, in US, Singapore and Arab countries, you can have the certification from AAPC. If it is just US, you can have a certification from AHILA. And if you want to work in Canada, you need to do a certification like Certified Health Information Management. If you want to do a certification from Australian Modification, you can do a certification from ICD 10A, sorry, HEMA certification, Health Information Management Association. Then, if you want to do a certification in Korea, you need to do a certification from KAHIMAMA, Korean Accreditation Board of Health and Medical Information Management. If you want to work in UK, you need to do the certification NCCQ, National Clinical Coding Qualification. Then, types of coding certifications. See, if you want to do the certification from AAPC board, there are 32 certifications for you. In that, the basic certification is the CPC, that is Certified Professional Coder. Apart from that, you will be having the other certifications based upon your experience and your specialty experience. You can enroll and you can do those certifications. Then, how to enroll for a certification? See here, you can click this link and search for an exam. Here, after clicking this link, you can go to search for an exam, like select by country. After that, you will be getting this option. You need to search it as like in select country, give the So after that, you need to select your country as India and then search. Then you will be getting like exam dates and everything here. You need to click on view details and exam registration. Here, go with the step 1, like membership status. You need to add membership with $190. And then step 2, you need to go with like select an exam. Select an exam. Here, go with the exam selection as coding in that CPC and select a voucher. Here it is like totally $530. So total cost is 530 plus 190. It is like $720 for you. Now the dollar rate is like 82 rupees, right? So it will be costing around for the certification for CPC like 68,000, like 68,000 around in Indian rupees. See the details of CPC certification. It is like it is an open book exam. Duration is 4 hours. Total marks are 100 and pass percentage is 70 and 2 attempts for you. All the questions are choose the correct answers only and there is no negative marking. All you need to mark on the OMR sheet and ICD, medical terminology, anatomy, physiology, HCPCS, medical billing. All these covers 30 questions and CPT itself will cover you 70 questions. Then software tools that are used in the medical coding, you can see here. Those are like Epic, Centricity, Advanced, Flash Code and all this. But here mainly the major platform of software is 3M and Flash Code. So you can see this is the software demo of 3M. See here, they are asking for find the code for removal of foreign body from the ear, right ear. So first you need to enter the demographic details and you need to click on the procedure and you need to give like removal. In the removal, it will be asking like whether it is foreign body or that. You need to select it as foreign body and then you need to give the anatomical location as ear. That's all. So you'll be getting a CPT like 69200. For that, you need to give the laterality. If they have stated it as right side means you need to click add modifier and give it as RT for that. Moving on to this is a flashcode software. Here, if you want to search the diagnosis, go to the diagnosis here and search on the basis of alphabetic. Like I am stating gastritis means click on diagnosis and search for G alphabet. And here on the bottom, you will be displaying like this. And on the left side, there will be a code for you. Then if you want to search for procedure, you need to search in the treatment column. If you want to search for a modifier, you need to search in the modifiers column. In such way, you need to search from the flash code. Moving on to the job description of medical coding training. See here, you will be having mainly every day, you will be receiving the patient encounters. Like you will be receiving 50 patient encounters. So you will be reviewing each and every patient encounter and you will be identifying the disease and procedures what they have underwent and you will be converting that into alphanumerical codes. Once you have assigned all these, you will not directly submit your claim directly. You will be submitting for your peer review or auditor review. Once they have reviewed only, then only you will be submitting to the claim. So this is what you will be doing on daily basis. So just look at here, what is the example of medical code? See, just look at here. It is a 32-year-old patient, came for headache, cough, sore throat, and everything. He does not have any history of smoking, tobacco, alcohol, except milk product allergy. Investigations they have done are CBP, throat culture, they have stated it as streptococcal bacteria. COVID is negative. Clinical impression, they have documented it as streptococcal pharyngitis. Discharge, they have stated it as septic So here what you need to code, for what reason they came for the hospital, that is very important. That you will be coding it as ADX or RFE. Here they came for headache, cough, and sore throat, right? That you can code it as ADX. And what is the finalized impression? They have stated it as streptococcal pharyngitis, so that you can give it as PDX, principal diagnosis. That is J02.0. And apart from that, you need to code for the investigations as well as the drugs that they have prescribed on the same day. See here, generally I have made it as only single page documentation. But in your life, it will not be a single page documentation. You will be getting at least 3 to 4 pages documentation. You need to review and you need to give it. Clear, ma? Yeah, team. So fine, team. So this is about your induction. Do you have any queries? Team, do you have any queries? Team, do you have any queries? Hello? Hello? Team, do you have any queries related to the certification or related to the certification cost or length of duration of course or anything? Do you have any queries on that, team? Hello?